Canterbury, Dartford and Maidstone, but critics say more resources are needed to support people at home. An independent assessment of the planned changes has revealed an urgent need for more community care, with mental health units already operating at full capacity. Let's talk about this further now with Nick Fairweather, a medical negligence lawyer specialising in the mental health field. And we're also joined by Theresa Murray, Deputy Labour Group Leader in Medway, also a member of the Joint Kent and Medway Committee, and they will be making the decision about the future of mental health provision in the county. Good morning to both of you.
Good morning.
Nick Fairweather, let's start with you. We're talking really a sense. We had 6 acute mental health units here in Kent. We lost Ashford and Thanet. The proposal is we lose Medway as well, which leaves us with 3. What do you think about that plan?
Well, I think it's bad news, and you're quite right to start by highlighting the fact that this is part of a rolling agenda of closing mental health sites throughout Kent. And that can't be good news for patients or their carers, because it means that people are displaced from their local community at a time of crisis and great vulnerability. And it means that they're going to have to, people who are close to them are going to have to travel across the county to see them while they're in hospital. So I think that's a bad situation, and my preference would very much be for a service to remain in the Medway area.
But this is an independent report. Experts from Kent County Council and Medway Council went in, they looked at the facilities we have now. They went into Medway Maritime Hospital, and in their view they said the wards there, very poor design and location. We agree that should close. And they also said that by closing this, saving that money, putting it back into the community, it creates an opportunity to improve the quality of inpatient care with improvements to staffing levels, therapies, staff cover arrangements, research opportunities, specialist services, the management of risk. They can only really see the upsides. They do say that we need to see this significant reinvestment and we want to know where it's going, but they can only see upsides. Why are you so cynical?
Well, you see, a mental health provision and a mental health service is more than just the bricks and mortar that it happens to be housed in at any given time. And I think there is unanimity in respect of the fact that Maidstone, its current facility where it's based and it intermingles with other wards and things, isn't ideal. But you know, the authors of this report were faced with something of a fait accompli, because it's the fact that there's no money available is what they're being told to build a new facility in Medway. And so it's not really, that was something that was really presented to them before they even began the report. And the other thing they've said is that there's no real evidence to hand currently of any sort of plan to make these 3 remaining areas a centre of excellence. I mean, I think the existing facilities at Medway are a centre of excellence in terms of the actual clinicians and people providing these frontline services. And what we mustn't lose sight of is that we're losing acute beds here across the county. Take out the geographical context to this. We are losing acute beds, and the current facilities are running at 100% when they should be running at 85% in terms of the acute beds. And the proposal as it stands does not envisage ploughing that money back in. What the report is saying, which I would agree with, if we are going to lose Medway, is that this should be done in a financially neutral way, which means that the monies that are saved should be put back into frontline services.
Well, that is one of the recommendations of the report. Theresa Murray, local Labour councillor, what do you think to that? I mean, it's not wholeheartedly backing all the changes, this independent report, but it is saying, and I'll read this line, it says, we strongly would encourage more of the money saved by closing this Medway facility to be spent on improving other parts of the local acute mental health system, a bigger crisis resolution, home treatment teams, above the increases already proposed. So it's saying we're not going to just rubber stamp this one. We want to see some of the money from the savings put into these kind of services. So does that assuage your fears in any way?
Absolutely. I think the Sitton report is a very good report, and it was the people on the committee and the members in Medway particularly who asked for that report, because when we first heard from the Trust about the closure of A Block in Medway that Nick has referred to, they hadn't put any proposals forward for strengthening the community mental health services. They'd simply said, they'd simply said that A Block had to close, it wasn't fit for purpose, and therefore we needed to move on. We asked for the bed survey to be done. Nick's absolutely right about that. It is at capacity. It's quite clear that there isn't any space to reduce acute beds. And everything that he said about the extent to which mental health patients in Medway are going to be displaced if they get into an acute crisis is right. It's not a good thing to do. It takes them away from their family, it takes them away from the things they're familiar with, and it prevents them from having a good recovery. I'll be going along to the committee today to fight for people with mental health problems, and particularly those in Medway, who in that report are clearly shown as having much less than other people. The community mental health service in the rest of Kent isn't as strong as I would like it to be, but it's stronger than it is in Medway.
Because also in the report it highlights that they've done, nationally they've looked at how far people in deprived areas have to travel to the nearest in-area acute mental health unit, and already, say Nottinghamshire, it's the average distance is 1.91 miles. Kent and Medway, it's 10.64 miles, and that would undoubtedly increase if you close Medway, wouldn't it?
Yes, on every measure, people in Medway are getting a bad deal if they've got mental health problems, and I'll be there to fight for them. One of the things that the report, not the independent report, but the papers that we've received about the committee today, one of the things it completely ignores is the stand that the police made, and in fact I was on Radio Kent talking about this, the stand that the police made by saying they're absolutely fed up and desperate with the way the mental health crisis team doesn't deal with people in a crisis, and quite often they find that they have to deal with vulnerable people for whom they haven't got any expertise to help.
That's right, and they have to often deal with them themselves and then take them onto a unit, maybe out of the county, which actually has a bed. Nick Fairweather, final word to you. What is to be done then? If savings have to be made, what is to be done?
Well, people looking at this as a short-term measure, one can point and say, look, there's some savings. But Teresa's absolutely right. The last time I was talking about this on Radio Kent, we were talking about huge sums of money being spent paying for private facilities to house local people outside of area because the local beds just didn't have the capacity to deal with people. So longer term, I don't think this is a saving. It's just a short-term saving, but it's an illusion, because if people are in need of acute admission to hospital, that's a decision that's taken by a doctor, and it's a statutory obligation to make the right decision on that. So doctors aren't going to change the way they're making those decisions. What we're going to end up with is too few beds still, and people being displaced out of area, or even within area, far too far away from their families.
Nick Fairweather, thanks for joining us. Medical negligence lawyer specialising in the mental health field. And also you heard there Councillor Teresa Murray, Deputy Leader of the Labour Group on Medway Council.